Sudden and unexplained weight loss in seniors is one of the most alarming signals that the body is undergoing something serious and potentially life-threatening. Unlike gradual weight changes that can be linked to diet or exercise, this kind of weight loss happens without any conscious effort, and it is usually the body's way of alerting us that something is deeply wrong beneath the surface. In older age, metabolism naturally slows down, appetite may shift, and physical activity often decreases, but when weight drops unexpectedly without any changes in lifestyle, the cause can rarely be ignored. Doctors often refer to this as unintentional weight loss, and in medical research, losing more than 5% of body weight within 6 to 12 months without trying is considered significant and a red flag. One of the major causes behind this phenomenon is underlying illness. In seniors, chronic diseases such as cancer, advanced heart failure, kidney disease, or chronic obstructive pulmonary disease (COPD) can all lead to rapid weight loss. Cancer, for instance, often produces chemical substances in the body that alter metabolism and cause the body to burn more calories even at rest. This process, known as cachexia, is common in later stages of cancer and can make weight loss unstoppable despite normal eating. Similarly, advanced heart disease puts immense strain on the body, causing loss of muscle and fat tissue, which contributes to a frail appearance. Seniors experiencing this often report that clothes suddenly feel looser, belts need tightening, or jewelry no longer fits as it used to, even though their diet has not changed. Another hidden cause can be gastrointestinal issues. Seniors sometimes suffer from malabsorption, which means the body is not properly absorbing nutrients from food. Conditions such as celiac disease, chronic pancreatitis, or inflammatory bowel disease can silently rob the body of essential calories and nutrients. Even without visible stomach pain, the body becomes malnourished, leading to weight loss. Infections also play a role. Tuberculosis and certain chronic infections that linger in the body can cause wasting away without obvious symptoms at first. The immune system of older adults is weaker, so sometimes weight loss is the first and only clue that an infection has taken hold. Mental health is another dimension that cannot be ignored. Depression in seniors is often underdiagnosed because its symptoms are mistaken for normal aging. However, one of the most noticeable effects of depression is a lack of appetite. Seniors may lose interest in food altogether, skip meals, or eat so little that the body begins to consume its own fat and muscle for energy. Loneliness, grief, or major life changes such as losing a spouse can amplify this effect. Unexplained weight loss in these cases is not just physical but a reflection of emotional suffering, which can shorten lifespan if left untreated. Medication side effects also contribute heavily to this problem. Many seniors are on multiple prescriptions for blood pressure, diabetes, heart conditions, or arthritis. Some medications reduce appetite, alter taste, or cause nausea, leading to reduced food intake. Chemotherapy drugs are a prime example, but even common pills like antibiotics, thyroid medications, or certain antidepressants can change how seniors experience food. The taste may become metallic or bland, or swallowing may feel more difficult, discouraging eating and causing gradual but dangerous weight loss. Nutrition plays an equally critical role. Seniors sometimes struggle with chewing or swallowing due to dental problems, missing teeth, or dry mouth caused by medications. These issues lead to avoiding tougher, calorie-rich foods like meat, nuts, or vegetables, resulting in nutrient deficiencies. Over time, the body loses muscle mass and strength, and this cycle accelerates weight loss. In severe cases, malnutrition sets in, further weakening the immune system and increasing vulnerability to infections and other health crises. The danger of unexplained weight loss is not just cosmetic, it is tied to survival itself. Studies consistently show that older adults who lose weight unintentionally have a higher risk of hospitalization, frailty, falls, and death within a few years compared to those whose weight remains stable. This is because muscle mass is directly connected to mobility, independence, and resilience against disease. Once the body starts losing muscle and fat reserves, recovery from illness or injury becomes far more difficult, and even small problems like the flu can turn life-threatening. Recognizing this sign early is crucial. Families and caregivers must pay attention to small details. Is the senior's clothing suddenly loose? Are they leaving more food on the plate? Have they stopped enjoying favorite meals? Even subtle changes in eating habits can be the start of something bigger. Keeping track of weight regularly is a simple but powerful tool. If there is a noticeable drop over a short period, it should never be dismissed as just aging. Instead, it must be investigated by a healthcare professional who can run tests, check for hidden illnesses, and provide interventions before the situation worsens. Prevention and management involve multiple steps. First, addressing underlying medical conditions is key. If an illness such as cancer or heart disease is present, treating it can help stabilize weight. Nutritional support is also essential. Dietitians often recommend calorie-dense foods, supplements, or protein shakes to help seniors regain lost weight. In cases where chewing or swallowing is the issue, softer and easily digestible foods can be prepared. For those struggling with appetite loss due to depression or medication, doctors may adjust prescriptions or provide appetite stimulants. Emotional and social support also play a role. Seniors who eat meals alone are more likely to skip them or eat less. Encouraging family meals, community dining programs, or even virtual meal times can reignite the joy of eating and prevent unintentional weight loss. Regular physical activity, particularly strength exercises suited to seniors, can help maintain muscle mass and prevent frailty. This not only stabilizes weight but also improves balance, energy levels, and overall quality of life. Persistent fatigue and weakness in seniors is often dismissed as a natural part of aging, but in reality it is one of the most important warning signals the body gives when something serious is going wrong. Unlike the normal tiredness that follows a long day of activity, this type of fatigue is overwhelming, ongoing, and disproportionate to the amount of effort exerted. Seniors experiencing this often describe it as a deep exhaustion that no amount of rest or sleep seems to fix. They may find themselves too tired to perform basic daily tasks like cooking, bathing, or even walking short distances. When weakness accompanies fatigue, the situation becomes even more concerning, because it signals a decline in the body's physical reserves and the loss of energy at a cellular level. This condition is often a predictor of serious illness, frailty, and even impending death if not addressed. One of the most common medical reasons behind persistent fatigue in seniors is cardiovascular disease. The heart, responsible for pumping oxygen-rich blood throughout the body, may be failing to keep up with the body's demands. In cases of congestive heart failure, for example, the weakened heart muscle struggles to circulate blood effectively, leading to a buildup of fluid in the lungs and tissues. Seniors often notice they become short of breath with minimal exertion and feel drained after the simplest activities. This constant lack of oxygen supply to tissues results in fatigue that does not improve with sleep. Similarly, coronary artery disease or arrhythmias reduce the efficiency of the heart, again leading to exhaustion that seems to come out of nowhere. Another significant cause is anemia, a condition in which the body does not have enough healthy red blood cells to carry oxygen to tissues. Seniors can develop anemia due to nutritional deficiencies such as low iron, vitamin B12, or folate, or due to chronic diseases like kidney failure or cancer. The lack of oxygen transport causes a persistent sense of weakness, lightheadedness, and difficulty concentrating. Even walking across a room can feel like climbing a mountain. For an older adult, this level of fatigue can be one of the earliest signs of internal bleeding, hidden cancers in the stomach or colon, or serious deficiencies that must be treated promptly. Chronic infections also drain the body of energy. Seniors are more vulnerable to infections such as pneumonia, urinary tract infections, or tuberculosis. Sometimes these infections do not present with obvious symptoms like fever or cough, especially in elderly individuals whose immune systems respond differently. Instead, the primary sign is crushing fatigue and a decline in physical strength. This is the body's way of signaling that it is diverting energy toward fighting the infection, leaving little left over for daily activities. Unfortunately, if left unchecked, such infections can spread, cause sepsis, or accelerate organ failure. Another often overlooked cause of fatigue in older adults is hormonal imbalance. Thyroid disorders are particularly common in seniors. Hypothyroidism, in which the thyroid gland underproduces hormones, leads to slowed metabolism, persistent tiredness, weight gain, and depression-like symptoms. Hyperthyroidism, though less common, can also cause muscle weakness and fatigue due to the overuse of energy reserves. Similarly, adrenal insufficiency, diabetes, and other endocrine disorders disrupt the body's energy balance, leaving seniors constantly drained. Mental health cannot be separated from physical energy levels. Depression is one of the leading causes of chronic fatigue in older adults, often showing up not as sadness but as a total lack of motivation, energy, or interest in life. A senior suffering from depression may struggle to get out of bed, eat properly, or engage in once enjoyable activities. Grief, isolation, and loneliness compound the problem, as the emotional burden takes a physical toll. Cognitive decline, such as dementia or Alzheimer's disease, also contributes to fatigue because the brain itself is under stress, struggling to process daily tasks, and overworking to compensate for memory loss. Sleep disturbances play a major role as well. Insomnia, restless leg syndrome, or sleep apnea are common among seniors and prevent restorative sleep. In particular, obstructive sleep apnea causes repeated pauses in breathing during the night, leading to low oxygen levels and restless, unrefreshing sleep. Seniors with sleep apnea often wake up tired despite spending many hours in bed. Over time, this sleep deprivation manifests as constant daytime fatigue, irritability, and a higher risk of cardiovascular problems. Medication side effects are another key factor. Seniors often take multiple prescriptions, and many drugs list fatigue and weakness as common side effects. Blood pressure medications, sedatives, antidepressants, and even antihistamines can dull the nervous system and drain energy. Chemotherapy and cancer treatments are well known to cause fatigue, but even medications used for everyday conditions can create a cycle of weakness and tiredness that worsens with time. Polypharmacy, the use of several drugs at once, amplifies these effects, making fatigue harder to trace back to a single cause. Nutrition and hydration are also central to energy levels. Seniors who are not eating enough calories or who consume unbalanced diets low in protein and essential nutrients experience progressive weakness. Malnutrition, often hidden because of reduced appetite, dental issues, or difficulty swallowing, reduces muscle mass and energy storage. Dehydration, another common problem in the elderly, contributes to dizziness, confusion, and fatigue because the body's cells cannot function without adequate fluids. Over time, this nutritional decline leaves seniors too weak to function independently and susceptible to illness. The danger of persistent fatigue and weakness lies in its compounding effect. A senior who feels too tired to move will often reduce physical activity. This inactivity leads to muscle atrophy, decreased circulation, and loss of mobility, which further increases weakness. It becomes a vicious cycle. Fatigue leads to inactivity, inactivity leads to weakness, and weakness worsens fatigue. Eventually, the individual may become bedridden, and in seniors, prolonged bed rest is often the final step toward decline. Immobility leads to blood clots, bed sores, pneumonia, and loss of independence, accelerating the path toward death. Families and caregivers must recognize fatigue and weakness not as inevitable but as urgent warnings. When a previously active senior suddenly cannot walk across the room, no longer wants to leave the house, or spends most of the day in bed, it is time for immediate medical evaluation. Keeping track of daily energy patterns, food intake, and sleep quality can provide doctors with clues. Blood tests, imaging, and a review of medications often reveal hidden issues that, once addressed, can improve energy levels and restore quality of life. Interventions depend on the cause but can include treating underlying conditions, adjusting medications, improving nutrition, or providing emotional support. Simple changes like encouraging regular physical activity suited to their ability, such as light walking or chair exercises, can maintain muscle strength and prevent decline. Ensuring adequate hydration, providing balanced meals, and addressing sleep issues can also improve energy. Emotional care is equally vital. Seniors who feel connected, supported, and engaged in meaningful activities often report higher energy and vitality than those left isolated. Ultimately, persistent fatigue and weakness in seniors is not just tiredness, it is the body's distress call. It signals that vital systems are wearing down, that reserves are running out, and that time may be short if action is not taken. While some causes are reversible, others point to serious illnesses that may already be advanced. Recognizing this symptom early and treating it seriously can sometimes extend life, preserve independence, and improve comfort. Ignoring it, on the other hand, allows decline to accelerate unnoticed. For seniors, fatigue is not only about lacking energy, it is about the body quietly signaling that its strength, like a flickering flame, is beginning to fade. Changes in mental clarity or confusion in seniors is one of the most striking and concerning warning signs that the body and brain may be approaching a point of serious decline. While occasional forgetfulness or mild lapses in memory are common in aging, persistent confusion, disorientation, or sudden changes in mental state are not normal parts of growing older. Instead, they often point to underlying medical problems, neurological decline, or life-threatening conditions. Seniors experiencing confusion may appear lost even in familiar places, struggle to recognize close family members, mix up words, or forget the sequence of basic tasks like dressing or preparing a meal. At times, they may seem detached from reality, speaking incoherently or reacting with fear, anger, or agitation. These episodes can come on gradually or suddenly, and in both cases they signal that something is deeply wrong. One of the most common causes of confusion in seniors is dementia, particularly Alzheimer's disease. Dementia is a progressive neurological condition in which brain cells deteriorate and connections between them break down. Early signs include forgetfulness, trouble with planning, and difficulty remembering recent events, while long-term memory remains intact in the initial stages. As the disease advances, confusion becomes more pronounced. Seniors may not know what day or year it is, fail to recognize their own home, or accuse loved ones of being strangers. Alzheimer's patients often experience sundowning, where confusion worsens in the late afternoon and evening. This steady loss of mental clarity eventually erodes independence and is a strong predictor of end-of-life decline. Another major cause is delirium, which is different from dementia in that it develops suddenly and fluctuates throughout the day. Delirium is often triggered by acute medical problems such as infections, dehydration, medication side effects, or even hospitalization itself. For instance, urinary tract infections in seniors often present not with pain or fever but with sudden, severe confusion. A once coherent elder may become agitated, hallucinate, or fail to recognize loved ones overnight. Delirium is a medical emergency because it indicates that the body is under extreme stress and may be shutting down if the root cause is not corrected. Unlike dementia, delirium can sometimes be reversed if the underlying issue is treated quickly, but delayed intervention increases the risk of permanent brain damage and death. Cardiovascular and respiratory conditions also play a role in mental changes. The brain requires a constant supply of oxygen and nutrients to function, and when this supply is interrupted, confusion quickly follows. Conditions such as stroke, mini-strokes, transient ischemic attacks, or reduced blood flow due to clogged arteries can impair brain function, causing sudden episodes of disorientation. Similarly, chronic obstructive pulmonary disease or advanced heart failure deprives the brain of adequate oxygen, leading to persistent fatigue and mental fog. In some cases, seniors with low oxygen levels may even experience hallucinations, paranoia, or bizarre behaviors that appear psychiatric but are actually rooted in physical illness. Metabolic and hormonal imbalances are another cause of cognitive decline. Low blood sugar in diabetics can cause confusion, dizziness, and even unconsciousness if not corrected promptly. On the opposite end, high blood sugar levels over time damage the brain and nerves, leading to gradual cognitive impairment. Thyroid disorders, particularly hypothyroidism, slow down brain processes and cause forgetfulness, depression, and mental sluggishness. Electrolyte imbalances from dehydration, kidney disease, or certain medications also disrupt brain signaling, resulting in confusion and, in severe cases, seizures or coma. These imbalances are often silent killers in the elderly, presenting primarily as mental changes rather than physical symptoms. Mental clarity is also heavily influenced by medications. Seniors are often prescribed multiple drugs, and interactions between them can cloud thinking. Sedatives, painkillers, antidepressants, and antihistamines can dull alertness, while some medications cause direct damage to brain chemistry. Even alcohol, when mixed with prescription drugs, can amplify confusion and lead to dangerous situations. Polypharmacy is a growing concern in elderly care, as the line between treatment and toxicity becomes thin with age-related changes in metabolism. What was once a safe dose may suddenly become overwhelming to an older body, showing its effects through altered mental state. Psychological factors add another dimension. Depression, grief, and anxiety can mimic confusion because they impair concentration, motivation, and memory. Seniors dealing with the loss of a spouse or major life changes may appear confused, but in reality, they are weighed down by emotional suffering. Loneliness worsens the effect, as isolation deprives the brain of stimulation and conversation, leading to a faster decline in cognitive abilities. Unlike dementia, however, confusion rooted in emotional pain can often be improved with therapy, medication, and social support. Nutrition also has a surprising impact on mental clarity. Deficiencies in vitamins, particularly B12, can cause memory loss, confusion, and even hallucinations. Malnutrition and dehydration are common in seniors who may lose interest in eating, have dental issues, or forget to drink water. The brain, highly dependent on proper nutrients, responds quickly to deficiencies with impaired function. In some cases, treating nutritional deficiencies can restore mental sharpness, but when left unchecked, the damage can become permanent. Persistent confusion and cognitive decline are dangerous not only because of what they signal internally but also because of the risks they pose in daily life. Seniors with reduced clarity may forget to take medications, or worse, take them multiple times by accident. They may leave stoves on, wander outside, or become vulnerable to scams and abuse. Confusion robs them of independence, making them reliant on caregivers for safety and survival. Families often notice the change during conversations, repeated questions, forgotten names, or difficulty following a simple story. These are not harmless quirks. They are evidence of the brain struggling to maintain function. The link between mental decline and mortality is strong. Studies show that seniors who develop significant confusion or delirium during hospitalization are more likely to die within a year compared to those who remain mentally clear. This is because confusion reflects systemic stress in the body. Whether it is infection, organ failure, or neurological disease, the brain is one of the first organs to show signs of trouble. Once the brain begins to fail, the rest of the body often follows. Families sometimes observe that in the final weeks of life, their loved one becomes increasingly confused, talking to unseen figures, mixing past and present, or drifting between reality and dreams. These changes, though heartbreaking, are often the body's way of signaling that the end is near. Recognizing confusion as a warning sign allows for early intervention. If caught in time, some causes, such as infections, medication side effects, or dehydration, can be treated and mental clarity restored. Regular medical checkups, medication reviews, and simple measures like ensuring hydration and proper nutrition can prevent many cases of acute confusion. Engaging seniors in mental activities, social interactions, and physical exercise helps maintain brain health and delay cognitive decline. Emotional support is just as crucial. Seniors who feel valued and connected are more likely to remain mentally alert than those who are isolated. Ultimately, changes in mental clarity are sudden. Confusion in seniors must never be brushed off as just aging. It is one of the clearest signals that the body and brain are under duress and may be approaching a critical point. While not every case leads directly to death, the risk is always present, and ignoring the signs can accelerate decline. For families and caregivers, understanding that confusion is both a symptom and a warning can mean the difference between prolonging meaningful life and missing the final chance to act. The fading of mental clarity is not just about losing memory, it is about the body quietly preparing for its final chapter. Difficulty breathing or shortness of breath in seniors is one of the most urgent and alarming warning signs that the body is approaching a critical stage of decline. Unlike occasional breathlessness from climbing stairs or exertion, persistent or sudden shortness of breath signals that vital organs, particularly the heart and lungs, are under severe stress. Seniors may describe this sensation as a tightness in the chest, a feeling of suffocation, or the inability to take a full, satisfying breath. Even simple tasks like walking across a room, bathing, or speaking in full sentences may leave them gasping for air. This symptom should never be dismissed as just aging, because it is one of the most direct signals the body gives when survival is at risk. One of the primary causes of shortness of breath in older adults is cardiovascular disease. Heart failure, coronary artery disease, or arrhythmias reduce the efficiency of the heart in pumping blood throughout the body. When the heart cannot pump adequately, blood may back up into the lungs, causing fluid accumulation, a condition known as pulmonary edema. This fluid interferes with oxygen exchange, leaving the person feeling breathless even at rest. Seniors experiencing this often notice swelling in their legs or ankles, a rapid heartbeat, and fatigue that accompanies the breathlessness. Over time, the inability to get sufficient oxygen to vital organs can lead to organ failure, making this symptom a strong indicator that death may be approaching if not managed properly. Respiratory diseases are another significant contributor. Chronic obstructive pulmonary disease (COPD) emphysema, chronic bronchitis, and severe asthma compromise the lungs' ability to exchange oxygen and carbon dioxide efficiently. Seniors with these conditions often experience shortness of breath that worsens over time. Simple activities such as climbing stairs, walking short distances, or even talking can trigger labored breathing. In severe cases, oxygen levels in the blood drop, causing confusion, fatigue, and a bluish tint to the lips or fingertips. Pneumonia or acute lung infections further exacerbate the problem, often developing rapidly and creating life-threatening situations for older adults whose immune systems are weaker. Anemia, a condition in which the blood does not carry enough oxygen due to low red blood cell count, can also manifest as persistent shortness of breath. Seniors with anemia may feel exhausted and winded even after minimal exertion because their tissues are not receiving sufficient oxygen. Causes of anemia in the elderly include chronic diseases, kidney problems, nutritional deficiencies, or internal bleeding. If left untreated, this oxygen deprivation affects every organ system, accelerating decline and increasing the risk of heart failure or sudden death. Unlike gradual fatigue, the breathlessness caused by anemia is often sudden and noticeable, alarming both the senior and those around them. Another less obvious but critical factor is fluid imbalance or kidney failure. When the kidneys are unable to filter waste efficiently, fluid can accumulate in the lungs, abdomen, and extremities. Pulmonary congestion from this fluid overload impairs breathing, particularly when lying down, which is why many seniors with this issue sleep propped up in chairs or with multiple pillows. This symptom, known as orthopnea, is a hallmark of serious systemic decline and often accompanies heart or kidney failure. Shortness of breath in this context is not merely discomfort, it is the body signaling that organ systems are failing to maintain equilibrium. Infections also play a significant role in causing acute or chronic breathlessness. Seniors are particularly vulnerable to respiratory infections, such as influenza, pneumonia, or COVID-19, which can quickly overwhelm weakened lungs and lead to dangerous drops in oxygen levels. Sometimes, seniors may not show typical symptoms like fever or cough but present primarily with labored breathing and confusion. The rapid onset of breathlessness in these situations requires immediate medical attention, as delayed intervention can quickly become fatal. Medications can also contribute to breathing difficulties. Certain heart medications, sedatives, opioids, and other drugs can depress the respiratory system, slow breathing, or cause fluid retention. Polypharmacy in seniors increases the risk of such side effects. Additionally, some medications may interact, creating a compounded effect that exacerbates breathlessness. For this reason, careful review of all prescriptions by a healthcare provider is essential whenever a senior experiences new or worsening difficulty breathing. Lifestyle and environmental factors may worsen the condition. Poor air quality, smoking history, chronic exposure to pollutants, or even extreme temperatures can make breathing more difficult for seniors whose respiratory and cardiovascular systems are already compromised. For instance, a senior with COPD may tolerate a cool, dry environment but struggle significantly during high humidity or extreme cold, which can trigger bronchospasms or fluid retention. These environmental stressors may seem minor, but in frail individuals, they can precipitate sudden health crises. The danger of shortness of breath lies not only in the discomfort it causes but in the cascade of complications it triggers. Oxygen deprivation affects every organ system, brain function declines, the heart strains further, kidneys may fail, and the body becomes more susceptible to infections. Seniors experiencing persistent or worsening breathlessness often become less mobile, leading to muscle atrophy, weakness, and increased dependency. This physical decline, combined with the strain on vital organs, makes shortness of breath one of the most reliable predictors that the body is entering its final stages. Recognizing this symptom early can save time, comfort, and even life. Families and caregivers should monitor seniors for subtle signs. Are they using multiple pillows to sleep? Do they pause frequently when walking? Are they breathing faster than usual at rest? Even seemingly minor changes, like avoiding social outings because of fatigue or gasping after climbing a single flight of stairs, may indicate that the body is under significant stress. Medical evaluation is critical, as tests can reveal heart function, lung capacity, oxygen levels, and potential infections or imbalances that require urgent intervention. Management and care strategies depend on the underlying cause. For heart-related breathlessness, medications to reduce fluid overload, improve cardiac output, or manage arrhythmias can stabilize symptoms. Oxygen therapy may be prescribed for severe lung disease or low oxygen saturation. Pulmonary rehabilitation, including breathing exercises and gentle physical activity, can strengthen respiratory muscles and improve quality of life. For infections, rapid diagnosis and treatment with antibiotics or antivirals are essential. Nutritional support and hydration are also crucial, as malnutrition can weaken respiratory muscles and worsen breathlessness. Emotional and psychological support is equally important. Seniors struggling to breathe often experience anxiety, panic, and fear, which further exacerbate symptoms. Calm reassurance, a structured routine, and relaxation techniques can help manage these episodes and prevent secondary complications like high blood pressure or heart strain. In advanced stages, palliative care may be necessary to ensure comfort, manage pain, and provide supplemental oxygen or other interventions to ease the struggle to breathe. Ultimately, difficulty breathing or persistent shortness of breath in seniors is not a symptom to ignore. It is a clear and urgent message from the body that vital systems are failing and that life is under immediate threat. While some causes can be treated, others indicate advanced organ decline or systemic failure that may be irreversible. Families and caregivers must take this sign seriously, seek prompt medical evaluation, and provide comprehensive support to maintain comfort and dignity. Breathlessness is not just a physical sensation, it is the body signaling that its strength is waning, and time may be limited. Recognizing and responding to this warning can make a profound difference in the final stages of life, helping seniors experience their remaining days with the greatest possible comfort and peace.